This is Dr. Dickerson from St. Thomas Heart Group, Gallatin practice, to discuss with you today about signs and symptoms of coronary artery disease and the symptoms that you should be aware of indicating possible heart attack symptoms. The initial comment that I should make is that there is a dilemma associated with chest discomfort associated with heart disease. Many people feel that the chest discomfort should be severe, disabling, before they should come to medical attention, but that is very far from the truth. The truth of the matter is that the initial forms of chest pain associated with heart attack may be very mild. And we as cardiologists divide these symptoms into three main groups. Before we get into the main groups, let me discuss with you the areas that you could feel discomfort associated with heart disease. And these areas are pretty wide. It can involve any place below the upper jaw, like the mandible, the chest, up until the abdomen, and either arm. Usually these symptoms, if they present in the arms, do not occur below the elbow. And in the arm, it's usually in the inner portions of the arm where you will feel these symptoms. So any place that I've just mentioned that you may have discomfort could represent heart disease. Now, getting into the three major forms of chest discomfort. The first is what we call chronic stable angina. Now, this is people that have blockage in the arteries, that the discomfort in the areas that I mentioned may occur during exertion or anything that will make the heart beat faster, and usually relieve with rest within 5 to 15 minutes. So, for example, if you're out walking briskly and you get symptoms of discomfort in the chest that is relieved with rest, this may be a symptom of blockage in your arteries of the heart. These are symptoms that are usually stable, and until you seek some advice, you may be concerned or confused that this may be related to being out of shape, having stomach issues, or arthritis. The second form of discomfort in the chest is what is referred to as an acute coronary syndrome. Now, an acute coronary syndrome is the similar types of chest discomfort that occur with exertion. However, it becomes more frequent and it occurs with less activity and usually lasts for a longer duration of time. Typically, acute coronary syndromes may occur and have a duration between 15 and 30 minutes, but usually not more than 30 minutes. The symptoms of acute coronary syndrome also may be associated with other symptoms: shortness of breath, sweating, a sense of fatigue, and a sense of impending doom. So any of these symptoms associated with discomfort in the chest, is imperative to have immediate consultation to exclude an impending heart attack. Of the third type of chest discomfort is acute myocardial infarction. And this is when usually the arteries of the heart are completely blocked or usually greater than 90% blocked. This discomfort is more severe and it is constant. It may last greater than 30 minutes and usually associated with symptoms of shortness of breath, sweating, nausea, sometimes vomiting, and again, a sense of impending doom. What is very necessary for people to understand is that these symptoms don't have to follow the progression from the first symptom to the last symptom. Many people, approximately 50% of individuals, have heart attacks, and the heart attack is their first symptom. You may ask, how can this happen? Well, in those individuals, they have plaque in the arteries, and the plaque explodes, causing acute occlusion of the arteries and a subsequent heart attack. Now, one thing that's very important with these symptoms, and of course, when you have a heart attack, is early presentation, to medical care. Early presentation is necessary because once a heart attack is well established and the heart muscle dies, it is impossible to revive that portion of the heart muscle. So early presentation allows us to intervene with possibly balloons, stents, or even early surgery to prevent extensive damage to the heart muscle. Now, the other thing that we always are interested in is pre-heart attack diagnosis of coronary artery disease. And typically, this is best done with what we call calcium scoring. Calcium scoring is able to evaluate the amount of plaque in the arteries, and the amount of plaque in the arteries is directly related to the occurrence of a heart attack in the future. So it's very important to have early diagnosis of coronary artery disease in order for us to prevent ultimate myocardial infarction with its complications. So these are just a few symptoms and things that you must keep in mind when you experience discomfort in the chest. Of course, not all chest discomfort is related to heart disease, but it is imperative for a licensed medical provider to distinguish what type of chest pain you have and where in the spectrum along the ischemic heart disease presentations you're in. So hopefully this has been information that will allow you to navigate through some of the issues that we deal with relative to heart disease. Thank you very much, Dr. Dickerson from St. Thomas Hospital, Gallatin practice.